Morning, good afternoon, good evening, depending on where you're watching me from. It's Dr. Kate, your radio, huh? There is something for us to learn today. That's why I'm here. On follow up on our series on male infertility, causes of male infertility. Today we'll be discussing testicular torsion. In fact, I should be talking to parents, intended parents, because sometimes, as at the time this testicular torsion will be happening, the male children or the males will still be young. So it's actually the parents that should put an eye on the children. Parents, if your son, teenager, infant, or at whatever age is complaining of pain at the area of the scrotum, don't go and give paracetamol and sit at home and kill his future. Just come and listen to me now, help that son. Because every adult male that will be having such experience, of course, from this lecture or from this teaching, you will not sit at home. When you have pain around your scrotum, around your area 1, don't go and sit at home. I will tell you what is testicular torsion. Testicular torsion, you know what testis is, isn't it? It's when the blood supply to the testis will twist over itself in such a manner that it will cut off the blood supply to the testis. So when there is twisting of that blood supply to the testis, there will be pain, severe pain. Some of the pain will start slowly, and at the end, severe pain. And that torsion, when it's cut off blood supply, and you do not do anything within the period of 4 to 6 hours, you are putting the testis at risk because there's no blood supply to it, at risk of death. At that 4 to 6 hours, if you present in the hospital, the doctors will be able to untwist that blood supply and restore blood supply to the testis. The longer the time you wait, the higher the risk that your child or you are going to lose that testis. If it gets to 10 hours before you get to the hospital, there's 50-50 chance that the testis is going to die. If it is now above 24 hours, of course, it's a 10% chance. And let me tell you, when the testis finally dies, what they do is to remove the testis. And if they remove that testis, it's a cause of infertility, but thank God they have to. But the problem is, what happened to one can happen to the other one. And it's even worse when you do not resolve that testicular torsion. You have been managing it. Maybe it's not the one that was severe enough to cause the death of that testis. And now it was reducing the supply to that testis. And it will now cause testicular atrophy. When it causes testicular atrophy, that testis that's atrophied, it will not be able to produce sperm in the future. That's another pathway to it. Another one is that when that torsion is there and it causes a breach in the testis blood barrier and now allowing some sperm to go into the system, that sperm that go into the blood will now cause formation of antibodies. Your body will now form antibodies against sperm. So anti-sperm antibodies will be a reason for infertility also in the future, because anybody who's got anti-sperm antibody in the system as a result of that leak into the system of sperm that stimulated the autoimmune, that person's sperm will have poor motility. When they do sperm count in the future, they will say the motility is poor. What am I telling you? Anything happening in area 1, pain there, don't go and be taking paracetamol and stay at home. As at the time the pain has subsided at home and gone, the testes are dead. It's true that it is one. What happens to one can happen to both of them. And as at the time you have the same thing happening to 2, you are in trouble. You can't bear children because the testes are supposed to form sperm that will bear children. And another thing, if you keep tolerating pain, and it is not a complete torsion, and it's the one that will cause bilateral atrophy of your testes, you will still not have children because atrophied testes will not have children. Parents, watch at your sons. Anytime they complain of pain at area 1, at the scrotum, take them to the hospital, the nearest hospital, because it's an emergency. And that torsion should be detorsion between 4 to 6 hours. It's a minor surgical procedure. Or let me not tell you that it's minor, but whatever it is, surgery should be done so that testis can be fixed. Okidopezi. They'll keep it in where it should be so that it will not be too busy next time and form another torsion. It is true that they can resolve it without surgery. If they resolve it without surgery, that testis will be at risk of a repeat torsion. So it's better to just do the surgery and fix it once and for all so that it can be free from the complications that are associated with testicular torsion. Testicular torsion as a cause of male infertility. Hope you learned something. Follow me. I told you there are other causes that will be coming forth. Hope you learned something today. Bye.